probably this way of transferring, right? Any ideas?
As far as transferring?
Yes.
Yeah.
With the acute stroke?
Yeah.
Okay. Neglect is one of the big issues you have in that time frame, and I would anticipate them having that, particularly if they tell you they have the an inclusion of the inferior division of the middle cerebral, and they sometimes go to that detail. That has been included on the exam, the inferior versus superior or posterior division of the middle cerebral. Now, the one thing about that and about this neglect, generally that area has a lot of collateral circulation to it. So they'll initially present with symptoms, and over time those symptoms will go down. Whether or not our therapy of trying to put all the sensation into the left side to them has an effect or not, I think might be a little questionable. Because it may just resolve without any intervention too. Just because of the collateral circulation improving it.
So exercising, but not exercising too much? Like the dyspnea or?
No.
Okay, sorry.
That's not what we're talking about. Just a neglect issue with them. That area of the brain has circulation. Swiping my pen. That area of the brain has circulation from both the inferior division of the middle cerebral and the posterior cerebral artery. So usually there's a good blood flow coming through the posterior at least. Even with an internal carotid nailed on one side or occluded on one side, you get collateral from the other internal carotid coming around. So these symptoms of neglect have a tendency to get better with time. Whether or not throwing sensation in there helps it improve faster or not, our thought is it does, but good luck trying to test that. It's really something that would be very difficult to find out. I really haven't seen studies that did that. Most studies are with all patients in the study, they put sensation in through the uninvolved side, and this is the result they got. I can't remember reading any studies where they randomized, some got the sensation, some didn't get the sensation. So, I'm not exactly sure. But you should try to put stimuli through that side if at all possible. But that usually does somewhat resolve, just with time. The 6-month patient that I gave some of you, that one should have resolved.
Oh, we were confused.
That one should have resolved. Within the 6 months, you can pretty much expect that to at least resolving to a point. It'll always be there. But they will start to become aware of that left side of the body gradually. By 6 months, they should be aware of it. They got to think about it more, but they're aware of it.
Are you going to go through the cases in later for program about the 6 months?
About what?
About the transfer with the 6 months. What my question is that...
Actually, hold off.
Okay.
So we're going there next.
Is somebody missing this book
But let's do the...
from yesterday? Sorry, it wasn't.
Somebody left the brown one.
Name in there.
Somebody's missing a brown one.
Oh, yeah, it is.
Come on, hold on to your book. Speaking of books, do you have my letter? Sorry.
They're not the greatest in the world, but there's a lot of information in them too.